Welcome to Gabriel's Gospel Grace, where you will receive wisdom and the Word of God.
Well, hello and welcome back. And good evening to you. Welcome to another Tuesday episode. I think you all know what it's about by now. And if not, always go back and check out the previous episodes. You'll also find in the playlist, there's a whole playlist called Tuesdays, where you can check out all the things we've talked about with all of our guest couples throughout the year so far. Now, today, we have the return of the Robertsons, who we haven't seen for a while due to communication reasons. My bad. But more importantly, though, we're following on kind of from the previous episode where Andrew and Jasmine were talking about till death do us part. But another phrase in that whole point of the marriage agreement, covenant and relationship is in sickness and in health. And I thought that was quite a good topic to bring up, and especially with our guests, because I know they're going to have great insight into this topic. So let's bring them in. Welcome back, the Robertsons.
Hello.
Hello. Happy New Year in Feb.
And to you too.
Well, it's great to have you back. And obviously the topic is in sickness and in health. Now, you guys have been married for how long now?
38 years.
Right, and you both look well, which I'm guessing is because when it comes down to it, you both look after each other and look after yourselves.
Yes, indeed.
Yeah, I would say that that's the case, but just going straight into it, it's also because we believe what God says about us and our health and our married life, which is, as you know, Gabe, a mainstay for us individually and as a couple.
Yep. And do you want to recap on how the healing within marriage is important?
In respect of, I'm not sure quite exactly what you mean there.
The promises of God, being a Christian believer, how that's another dynamic to our Christian marriage versus secular. Yeah,
because we believe everything that God says, and we believe what Jesus has done for us on the cross. It very clearly says that Jesus took our sin, took our sicknesses, took all our judgment on the cross. So we are delivered from that. And as we believe on what he has done for us, we can receive all the benefits of that. So there's no reason that we should walk in sickness, or there's no reason we should walk in poverty. There's no reason we should walk in ill health of any kind, or loss of any kind. But we can, by believing in his promises, receive everything that he says that we should have in this life. And it is a good marriage that we should be having. As we follow that, love one another principle that he showed us. And, because if you hate each other, it's not going to be a very good marriage, is it? And that flows through into health. If you've got a merry heart, which comes from believing in Jesus, from all the things that he's done, and the fact that we've got a new heart when we believe in him. If we've got a merry heart, then it's like a medicine. And it fills you up and it heals you from all the problems as well. So there's many, many reasons. I think we could go on for half an hour on that subject alone.
Amen. And of course, the other thing is we drew a comparison, didn't we, between the marriage covenant and the covenant with ourselves and God. And like God provides, and of course this now comes to this aspect of love, which I think is where we're going to in this episode really, is that we have the agape love or agape love, which is different to the emotional kind of love people expect. And of course, with yesterday being Valentine's Day, the focus is on that romantic kind of love, which we know leads to eventual marriage. But being married in sickness and in health means it's more the agape love, isn't it? It's more that love that goes beyond the emotions. It's not that, today she looks stunningly beautiful with all her makeup on and she's got that perfect dress on, and I'm going to have to say this. I'm sorry to break the silence on this to all those bachelors out there, but women don't wake up looking like they do on a date. I'm just giving you that heads up now. So be aware. You really have to love a person to understand they're not like they look like in their Instagram account. But that's the problem, isn't it? When someone's not well and they're sick, and often, I mean, I can talk from my own experience, when we're not well, we can't always feel ourselves. So sometimes that merry heart drops off. So at the very least, John, as you were pointing out, that's why we have this great relationship with our spouse to help lift our spirit, to keep us in that positive place and to share that love and, of course, pray for us. But what about the practical, physical side of these things? How does that impact on people? And I know that's partially why this episode I really wanted to bring in John and Lesley, because they have a long marriage where they've clearly looked after each other. And we know John's partial to his cake. But Lesley, I think we may have touched on it before, but you want to just give us a little bit about your career background so we can bring another dimension to this episode.
Well, I began in nursing way back in the 70s, and I was trained up in Aberdeen. Then I moved to Glasgow, where I worked I became a midwife, and then I worked in the renal transplant unit. And then I came to Dumfries, and I've worked in Dumfries. I went then back up to be a qualified district nursing sister. And I came back and got married to John. And I then stayed in district nursing that was approximately 20 years, which was one of the richest parts of my nursing career. An experience of working closely with families and people.
So we could say that you're a professional caregiver. I mean, obviously you're a healthcare worker, but caregiving, and of course, I mean, from a dignity point of view and how you treat patients, are there sort of rules with regards to respect and how you deal with these situations? I mean, do you sort of go in and go, you're sick, do as you're told, or is there a little bit of TLC in there?
No, I don't know how they do it now, but I was trained and equipped, and also because I was a Christian, I had that part to me that I always, when I meet somebody, whether they're in a bed in the hospital or whether they're in their own home, I meet the family and the person on an equal footing, no matter whether they're somebody that's been a beggar in the street or whether there's somebody that's very high up in society. I meet them where they are. I accept them where they are, and I then approach them with honesty, with sincerity for their best outcome. One of my favourite sayings in nursing career was, never leave an indelible stain in that person's life, meaning never do anything where possible that is going to leave a nasty effect for the rest of their lives. So that's how I go in and I assess very quickly. I can tell very quickly how things are. What's the temperature like in that house? Is it argumentative? Is it frightened? Are they, all of these things go through my mind as I'm speaking to them. And you soon assess something. And my job then was to try and see how then I can actually help you through this. Are there people I can bring in? Is there a occupational therapist I can bring in? All of these things to enhance that care package that underpinned that family.
Can you remind everybody, Lesley, about how you came to have the ability to care when you first came to know Jesus?
Oh, right. When I was knocked down.
No, just when you were born again. When you.
Oh, yes.
Yes, now you couldn't before, but you did after.
Yes, I remember.
I think that's important.
This is when I was training as a midwife, because in my first few years in training up in Aberdeen, I wasn't really a Christian. I was brought up in a semi-Christian, loose background. Believed in that there was a God, but that was it. But when I came to Glasgow and I was doing midwifery, because somebody said in one of the rooms, we used to have coffee at night, and this girl, she quite bluntly said to me, yes, Lesley, you'll go to hell if you don't believe in Jesus. Well, that made me livid. So anyway, I won't go through the whole thing. But eventually I came to know the Lord for myself in that same place. And one of the things, because the next morning I thought, oh, was that real last night? But I'll tell you what really told me something had changed in me. When I went in to look after ladies, sometimes when you look after somebody who's very sick, the smell, the odours can be powerful. And the next day, I could have lifted up this woman who'd been very sick because of things that had been going on. I could have lifted her up in my arms and just loved her to pieces. That spoke volumes to me. I knew that I was different. I knew from that day on, my nursing career was the calling on my life, and that the Lord was very much with me, and he remained. He taught me a lot of what I actually learned throughout the years. And as I watched people being cared for, I knew, well, I'm not going to do that. That's terrible. Well, I'll pick up this. This is good. And the Lord taught me a lot, how to treat people, how to meet them. But I also had good teachers, which I don't think is quite so available now.
No. And I think you've touched... Yeah, I'm going to say, I think you've touched on the important thing there, which is when we love someone, like you say, with the Lord. I mean, it's true. I mean, we're taught to love sinners. And just to be clear, it's not about people with bad behaviour. I mean, the Bible sort of describes lepers and the unclean, effectively, which people would have stayed away in society. But to love people beyond the physical smells, the sight. I mean, it's almost switch off your senses when you think about it. Love people without engaging the senses.
That's right.
But when it's a loved one, your spouse, that should be an elevated love anyway. It should be very much like that love. But as you've just described, your ability to love someone else and go beyond the normal, we're going to come back to that in a minute because that's obviously the bulk of it. But I'm going to just quickly move on to pride and embarrassment, especially with men. So John's already smiling. It's much easier to allow a doctor or a nurse, a stranger, but they're medical, to invade spaces and do things that you wouldn't let your spouse do. But then that's the irony of that situation, that the person who might be the person who should be giving you that care, you're preventing them from caring for you. So in the rest of your life, you allow it. But when them times come to be cared for, we can often block it, can't we? And I'm sure you possibly came across some situations where the family have probably tried to do more for the loved one, but it's the loved one that sense of pride. I mean, John might be able to speak on this, that, the embarrassment of allowing your spouse to care for you. And in a way that becomes a barrier then, because the person who loves you is being prevented from loving you.
Yeah, you could let it be a barrier. I mean, obviously we haven't had really bad ill health that we have to cope with on a week by week basis or anything like that. The attacks on our health have been short, sharp, and to the point, as it were, and we come through them as is right and proper, because we walk through the valley of the shadow of death. We come out the other side. So we've not really been tested hard on that, but we know that from our own relationship with Jesus and the fact that we do love each other, love suffers long, never does wrong, always hopes, always trusts, always perseveres. Just quick extracts from the Corinthians there. We know that we would do all of that. We would put up with whatever it was that was needful to be put up with at the time. And Lesley has to put up with me all the time. You saw that by the eyeball like there.
Well, I mean, the thing is, now here's my sexist comment of the episode. There has to be one thrown in there somewhere to trigger some people. But it's very easy and common for ladies to talk about their health problems and their relationships, and they share these things quite openly and publicly. Men will not do that. So we know part of the problem with prostate cancer is the fact that men won't share it with their spouse. They won't share their problems with their friends, to even have their friends say, have you considered this? So there is, and probably I'd say it's probably more in that direction anyway, that men are probably the ones who put the barriers up when it comes to sharing their health concerns. Women are much more open on that.
Yeah, you're probably right. I have no real problems in that respect, that I would share anything that was needful with Lesley, because what am I embarrassed about? She's seen everything. And if there's a health issue, my personal way of dealing with is I want it dealt with, and if Lesley can help, then Lesley would help. And if she says you need to get X, Y, or Z, then I'll take her advice on it. So if there's anybody listening and they are feeling embarrassed about it, well, my answer to that is stop feeling embarrassed about it. And start to talk about it. Start to talk about it positively, not negatively, not as if it's the end of the world or whatever, but talk about it calmly, positively, and from that, then you can start to find a solution or an alleviation or something like that. So no, I'm not the best one to speak from. In fact, I don't hide things in that respect. I don't gather them up in myself. I would prefer to talk specifically to Lesley, but also to other men, you know, who are friends. I don't personally have many real friends, you know, people that you can talk to in detail about things, but there are certain ones that I would, because you know that they love you, and they're not going to come on an attacking basis, but they're going to speak to you from the basis of love for you, for your best outcome. So, and I think that's maybe one of the reasons that a lot of men don't want to share, because they're scared or they're apprehensive of, maybe that's a better word, they're apprehensive of the response that they're going to get. Maybe somebody might try to demean them or condemn them for not being a man, not standing up to things properly. But no, put all that to one side. If it's a situation that needs resolved, it needs resolved, and just get stuck in.
And Lesley, would you agree with that comment that often ladies will share these things more openly and happily to do so?
I've met a lot of men tend to be, because they are seen as the protector and provider, do tend to put on a strong face for their loved ones.
Yeah.
So as a nurse, I usually get all their complaints. So they can talk, but you're right, they find it difficult because they don't want fear to grow in their family or distress to grow in their family. So they keep that strength. So having somebody like me coming in was an outlet for them. But also you do get, I've dealt with the groups of men as well, and they are just like women. All they do is complain about this, about that, because it's men together. So I don't see a difference. So yes, there's a yes and a no, but women are more easy to come forward because they don't have any hang-ups about sharing about things that men can have. Yeah.
And so you've already clearly described there that it was more common for men to reveal all their medical issues openly with you. So it's not just simply a man-woman thing. It is more to do with the fact that they don't want to share it to look weak or make the family look weak or care about them in a way that's distracting.
Face. They don't want face. To face, which is another way of putting it. Yeah.
Yeah. So if there are any men listening now, apart from the obvious, I'll go talk to someone. I mean, I know we're all going to agree. The first thing is, if you're struggling, pray for the strength to share it, or pray for the right person to come into your life that week, who for some reason you feel like able to open up to. But if you are a spouse of a man, well, let's go in that direction first. How can you encourage your man to trust you enough to open up?
It's your approach. It's honor them, be understanding. Understand that a man doesn't want, or your husband doesn't want to be seen as being weak, and let them know that it's not a weakness if you're ill. It's not a weakness if you feel crook or you feel really yucky and horrible. That is not a weakness. It's how you handle it together. You can actually encourage them and say, well, look, just take it easy for 2 or 3 days. Let's see how it works out. It's how you then interact that you can take the ease. You can take that sense of value and make it work so that the person still feels valued, still feels loved, still feels in control. Don't overdo it with one thing men hate, and I hate it, is being fussed over. Don't fuss. Just take things as they come. If they feel sick, go and get a basin and bring it through. Don't be sympathetic, because sympathy does nothing for anybody. Practical help with love is far more meaningful than somebody patronising you and saying, there, don't worry. That's the worst thing you can say. Meet them where they are trying to connect with you. You've got to listen to what they're saying, not give what you think you should give, but actually listen to what they're saying and try and work out what the best answer is, so that you meet each other in a nice level playing field. You're not having a competition as to who's the strongest or the weakest. It's about trying to help that person who is feeling horrible. That's the main thing.
Amen. And I think
Penny.
that is such wisdom, Lesley, and I'll certainly be using this in the clip. But
here's a wee quick thing. You know, that we've shared this before. How one day all of a sudden we think it was an attack of a mini sort of stroke thing, and I was lying on my bed unable to speak. My arm was going blue, you know, sheer terrible pain in the head, and I was not able to communicate, just lying there like a sack of tatties in agony. And the first thing Lesley did was, what on earth am I going to do here? And she prayed. That's one of the most important things, you know. What Lord, what can I do to sort it? You finish.
And the Lord said a very strange thing: make him a cup of tea. And I thought, oh Lord, he doesn't drink tea. He doesn't drink tea. And is that the right thing to do? Nursing wise, that was the worst thing to do. And but the Lord said very strongly, make him a cup of tea. So I went through and I made a cup of tea and I brought it through and I said to John, I lifted them up and said, here, drink this. The Lord wants you to drink it. And then it struck me. I knew what I had to do next. Get a basin, because he had to throw up. And see, when he threw up, that changed the blood pressure in his system. And he started to recover.
Wow.
Yeah.
Wow.
Because the thing was, I had phoned the doctor and he said, what do you expect me to do? I'm not a miracle worker.
So as a bit of solid advice for everybody listening, Gabe, as you've already alluded to earlier on, that whenever there's a problem arises, the first thing we should do is pray to God that we get wisdom on how to deal with this situation that has arisen. Whatever that situation is that has arisen, whether it's a sudden report of cancer, prostate cancer, whether it's you know, cervical cancer, infections, colds, flus, anything, any attack of sickness, we should first go to the Lord and say, what's your word on this, Lord? How do I deal with this? And get the wisdom from him first. Human wisdom fails us. Yeah. My wisdom fails me, but God's wisdom never fails anybody.
Yeah.
No, and I think the good example there is, and I think Leslie's well aware of this, because she's got a medical background, she's going to typically default to her knowledge and her wisdom.
Yeah.
And that's, I was thinking about that when you said it. If you were just a layperson, a nobody, and you just called 999, and the person said, oh, quick, just do this. You just do it. Comes back to what we keep saying on this episode. If Jesus says it, then do it. And without question, because we don't want to know, we don't need to know the mechanics of how it's working. It's just we do it. That's the emergency treatment in that moment. And only afterwards, of course, you get the revelation of, okay, wow, I see what you did there, Lord. That's, you could work.
Especially when that particular incident, one of the famous things that we do recount about it is the Lesley phoned the health service at the time, which was straight through to the GP at the time,
whom I knew,
and she said, "Oh, so and so," and he says, "Well, what do you want me to do about it? I've got no magic cures." So she was left without any help. We don't know why. He was maybe doing something else at the time. But so she was left. She had no option other than to do what the Lord says.
That's brilliant. And it shows faith as well, to trust. I mean, again, other medical people, other Christians would simply rely on their medical knowledge. And the result could have been he'd have died. Then you'd have spent a lifetime of guilt thinking, this is always the case, isn't it? What could I have done better? What more could I have done? How could I have done this differently? And the Lord...
Or indeed, Gabe, if it had carried on as a full-blown stroke, I could have been impaired for the rest off. There's all of those potentials.
All them possibilities. Yeah. So the power of prayer, people underestimate it every time.
Amen.
But let's go to the other side then. And again, so we've just looked at from the perspective of people keeping it to themselves and not wanting to be cared for. And of course, the other thing, like you said, coddling people can lead to a victim mentality. And I think we see too much of that rolling out in society and medical. You know, I know people with conditions that at first they didn't agree with it. Now they live by it. You meet them and they're defined by that condition. This is who I am. Yes. I am disabled. I am this sickness. I have cancer. Almost a bit like if you said, I have £1 billion in the bank. It's like, well, you're banking that. You're banking that condition. So, yeah, good luck with it. But the other side, of course, is how do we care for people? So, of course, I think this is often interesting. I don't think it's easy for men, but I think it's harder for women who don't automatically have an affinity to care for people. And I have seen that with certain kinds of, like, possibly young mums who they had a dream of what it would be like to have a baby, but when the reality kicks in, because I mean, you must have had this a lot in midwifery, and I know people personally, this magical bond, the baby mother bond they talk about. And of course, when that magically doesn't happen, that normally results on antidepressants and postnatal depression, not because they've actually got it, but because they were expecting this miracle bonding that hasn't happened, where they'd have this synergy, almost a psychic connection to know what the baby wants all the time. And I think that also echoes then into adult life, where a woman is expected. So we talked about men being the strong provider and they need to be like the column of power in the home. But then also, I think for men and women, but where a woman is not able to do that easily. I mean, you must have come across that. And even for nurses, perhaps, I mean, you just said you had your transformation moment with the Lord, but how would you kind of guide and help people to overcome that?
I think with a lot of women who, it's not a natural thing for a woman always to be a carer. It depends how the Lord or how she's been brought up, what her background's been, but it's trying to break down some of the fears. If I had somebody like that, I would try and assess what their issue was. Is it a real fear? Is it something from their past? Is it something they've experienced before? And what is it that what side of the caring have they a difficulty with? So say, for instance, they couldn't couldn't do just personal care, wash their face, etc. Then I would try and get somebody in to do that for them, but they could still be the 24-hour carer, looking after gentler sides of caring. So it's trying to introduce that person into situations very gently, so that either they are surprised that they can cope, or they actually reverse all the more. And if they reverse all the more, then I'll probably just say, this is not going to work, really. We need perhaps to get your loved one into care for a while until they either recover or they pass from this life. But yes, it's a rarer occasion that women can't cope. But the other side of it nowadays is a lot of women are some of the main earners in a family. And that then puts a huge burden onto a woman who wants to care and will go all out to care, but she'll actually nearly burn herself out trying to endeavour to be the super wife, the super mum, the super provider. And that can be a very hard place for a lady. And I would say you need to then try and take help. Don't be too proud to take help in. Don't be too proud to let things and delegate things. Even to maybe if you've got a couple of grown-up children, that they could do little things for you, little jobs for you, things like that. There's simple things that can be done to release it, to release pressure. It's knowing who you are and what it is you're fearful of. Once you know what you're fearful of, you can think of different ways of coping. But it's trying to lead somebody into to knowing. It'd be good for somebody, if you've got a situation where you're trying to care for somebody and you're really fearful, you don't know what you're doing. Maybe you've got a best friend, a granny. Things like people like that can be really helpful with just down to earth situations that they've maybe experienced, or know of somebody who'd be able to help. Or speak to one of the nurses at the practice that you're with. But again, I'm not sure what kind of background training they get nowadays. I was trained very much about what's in a person, what surrounds them. I don't know if they still get that kind of training. But they should be able to help in practical matters, i.e. if it's somebody dying, you can get Marie Curie, you can get Macmillan, there's lots of other options. You can get equipment, there's things that can come in that will make life so much easier.
Yeah, thanks for that. I'm going to bring in an analogy from before we started this episode. I mean, you shared with me you've both been really busy doing DIY since the new year. And I think the thing is, we talk about marriage as a home. And of course, the other side is a home is often a house. Now, I think you were sharing the fact that where possible, you do as much DIY as you can. And I think that's great. I think we should all do that. But I think when it comes to caring for people and loving people and that side of things, people don't realize that it is a skill that can be developed. So, for example, if you decided, look, we want to replaster the house, but we're not plasterers, it could be very cost effective to do a short course on plastering. Now, you wouldn't think twice about doing that. You'd literally say, oh, guess what, Gabe? We're thinking of plastering the house. We're going to do a little course. We don't mind a few errors. We know it'll be a practice. We'll start on the worst room first, the one that no one will see. But when it comes to the big stuff like caring for someone, people don't have that mindset, do they? They don't think, I can go on YouTube. I can watch how to do this. I can go and practice this. I mean, it comes back to a baby again as a midwife. You know, the first nappy I changed, well, that's a bit like the first time you changed a tyre. But typically by the end of the week, you've had plenty of practice now. Yeah, and of course, most things, it's practice, and we keep doing it. So I think caregiving is something we practice, isn't it?
It is. And that's, I think, what taught me was also in the renal unit, because we taught people to do dialysis at home. It was the first of this, trying to get them into their own home. So actually teaching and training people, a lot of it is bringing confidence, giving them guidelines that will create a confident pathway for them to follow. So they do this and they've done that and they've got that and it works. And their confidence grows. And one of the things, and this is a side shoot, but I think it's a good one to go down the route of. Within the renal unit, people came in every second or third day to get dialysis. And we split the groups into two. One group we left as they were. We used to put them on. We did their arm with needles and all the rest of the things that go with it. I won't describe it all. The second group, we decided to train them to put, it's 2 needles they just put in their arm, to put these needles in themselves. And to do that, I, along with others, the nurses actually said, well, we had to take monthly bloods off ourselves because of things. So I'll do it. I'll do my own bloods. So I showed them that I wasn't fearful. So we taught them how to do it. And actually they became so protective. They didn't want anybody else to help them now. They even got to know how to work the machine. And actually, you know something, these people from not going to work, a lot of them just decided that's it, I can't go. They were actually getting employed again and going back to working, maybe part-time. It turned their lives around. And so there's something about that. It's trying to get as much goodness out of caring so that you get confident in what you're doing. And that's where it's good if you've got somebody that's seriously ill, having some nurses around that would actually be a promoter of how best to do that. You know, you're doing that awkwardly. Can I show you an easier way? And that can build over a few days. You can build great confidence in somebody to actually, oh, that works. I can do it.
But you know something, that in a situation where there's care of whatever level that's needed, we can stop ourselves from thinking that we are even capable or possibly approaching it, because we can say, I can't do that. We literally say, we block ourselves saying, I can't do that. Whatever that is, wiping up or bandaging up or whatever. But the truth is, if we overcome that, I can't do that, with what God says, which is, I can do all things through Christ who strengthens me. So that which I can't do, I'm not good with smells. In close proximity of a room with no ventilation. I have proven this. It says, but we have had a situation, not personally, but helping other people, dear friends in the Lord, who were at the end of their life and so on, where we've had to go and help them out, and it's been messy. It's been not pleasant. And twice I had to exit from the room, to kind of overcome the thing that was trying to overcome me, and the revulsion, the physical revulsion I was feeling at what I was having to deal with. But because I loved them, I wanted to finish the course and helping them to get them comfortable, to get them back on a level keel. And I kept going. I can do this because Jesus has strengthened me. You know, busy praying away as well, praying in tongues at the same time. So it is possible to overcome. And if you say you can't do it, well, you're stopping yourself from even thinking you can. So you can do it. Whoever it is that's listening that this might be speaking to, you can do it. You can look after that person in this way that you are being challenged to think you can. Because you can do it. And especially if you pray and ask Jesus for more strength to do it, and you will be able to do it. And eventually, because you love the person, you will do it well, and it will be good for them. And actually, it would be good for you as well in the long run.
Amen. And I just want to highlight something John said there for the viewers watching this. You were repulsed by the smell and what was coming out. The person receiving needs to understand that wasn't about them. They need to separate the illness and the consequences of that illness and not see it as, oh, look, I'm making John heave. No, the situation, John's loving you and he's overcoming his own problem, but he's loving you, and you can't take that on yourself to see it as rejection from John. And that's, I want people to pay attention to that. Don't look at the signs and say, oh, that person's, I'm repelling them. You're not repelling them. They're fighting their battle to come to your aid. Recognize, separate them like a knife.
Yeah.
Absolutely.
I went out so that I would not show any of the more obvious impact of it, and went straight back in again. You know, seconds away, ding ding, round two. So Lesley, you were going to come in there. Sorry about that.
No, I was just going to say that it's caring for people is very complex. It's there's no easy answers, because there's so many facets. Is it a short-term illness where somebody's really sick at both ends? Bad enough. Is it something that's going to be chronic but not life-threatening, or is it life-threatening? There's different levels, so it's complex in that way, but it's also complex in the characters that are involved. It's there's no real, there's a balance. It's trying to find out what everybody feels and how they can cope and what their situation is and how they see themselves in the Lord. Do they have any faith? There's huge amounts of things that you've got to consider when real serious illness hits a family.
Well, I'm aware of the time, but I just want to bring in the third aspect of what we're talking about, because that seems to come into it. And I want to come back to, again, another specialist topic for you, Lesley, and that's the newborn baby. Now, when the newborn baby is handed over, it is so delicate and precious, and you know, it's you literally see people hold it like a glass jar. And of course, and even for yourself, and to be honest, as a parent of two children, the first child is always, they can be 4 years old and it's still, oh, don't drop them. Second child comes along at 2 and they go, oh, look, they fell over. You go, yeah, I'll get up. You've moved, you know, you grow from that. But it's that recognition, because even today, people will say, oh, you know, you got 2 children, you've got a granddaughter, and they'll hand me a newborn, and I go, and they go, well, you know what to do. And I go, no, I had a newborn for like a few days.
Yeah.
And then they've already moved on. But it's recognising that even in that situation, you don't know how to care because you care too much. And again, I think that can be the other barrier, is that I love this person so much, I don't want to do wrong. I shouldn't do this because I will break them. I may get it wrong. I mean, my ex-wife, she was a carer. And she used to do ridiculous hours, and she was compassionate and really cared about the people she cared for. She'd stay late in the evening sometimes because no one else would come on shift. But when the opportunity came to take on the role of a senior and start doing the drugs, she'd have been perfect for taking that role in managing, but that put fear into her. The fear of taking responsibility for the important sides of the care. So it's quite clear for me, even in a profession, most people will fear doing something wrong.
Absolutely. And it's the what comes after it, because a lot of people do feel guilty, and guilt's one of the most destructive things, a very destructive thing. You know, when somebody has cared for somebody as maybe come into their last days, especially, and they've done something that they think is wrong, and they are guilt-ridden, and it's a hard thing to try and get them to see that it wasn't their fault. They didn't have the experience. They didn't mean to do harm. And yes, guilt can be a nasty force in somebody's life. It can be very destructive.
Yeah, until they realise that, what Jesus offers, which is freedom from guilt. You know, there is now therefore no condemnation, no guilt for those who are in Christ Jesus. And so that's what he brings, that removal of the guilt from whatever you're doing. If you think you're doing it wrong, well, stop feeling guilty and just continue to improve. As you say, Gabe, you get better at things as you make one mistake, you don't make the same one twice.
I mean, and of course, even in your situation with John collapsing, I mean, of course, they'd have said, you should. I mean, they keep having them adverts on, don't they, about strokes and, how you must respond instantly and get on the phone 999 and all that. You were the nearest to an expert in the room. And even in that moment, you kind of didn't know what to do because it's your loved one this time. It was unexpected. So you're the first on the scene, but actually prayer was the solution.
Absolutely.
Now, the other thing is, I'm just going to kind of conclude here. John, if you were going to start a business employing possibly up to 10 people, would someone there have to be a first aider?
It's not my first thought. Not if I was having being technically minded. If it was a business that was needing 3 joiners, 3 electricians, and 2 plumbers, or something like that, the first thing wouldn't be employ a first aider. No doubt, just within a few days of having employed them all and realised that one's just bashed his thumb, I would realise that we'd have to have somebody who was first aid trained. So you would then adapt as you have to do, and you would get somebody first aid trained so that they're the first point of call, and so on and so forth. Does that answer?
Yeah, well, that's why I just wanted to. I mean, it's no good asking Lesley. She worked in a healthcare; they're all trained. But this is the point, isn't it? How come if we employ people, there's an onus on us to actually have someone trained as a first aider? Yet when we get married or have a family, no requirement. We're just abandoned to work it out for ourselves, and none of us are proactive enough to say, you know what? When little Susie traps her thumb in the door, it might be useful to know what to do in that situation, or how to get a splinter out a finger, or possibly how to use dock leaves on nettles, but I don't think they use that anymore these days. So again, it's that kind of, if you're watching this video now and you're genuinely assessing yourself and saying, you know what, I don't think I would know what to do, then do something about it. Pray about it. And that comes back to our faith as well. Even new Christians today, they don't step out with faith and go into the workplace tomorrow and say, hey, guess what? You know what? I found Jesus yesterday. And I think all these wonderful things are happening in my life. Because sometimes it takes confidence, and confidence comes with faith. And it's a growth process.
Yeah.
That's right.
Yeah.
And everything we've talked about so far in our marriage, when we talked about the 3-legged race, walking together, it's practice, it's growing together. And I think often the caring and sickness in health is probably the one aspect in that vow that most people don't seem to take attention to. They're too busy looking at the sunny day, not realising the rainy ones may come.
Yeah. And the truth being told, rainy days maybe don't come for some couples, maybe do come for other couples a lot more than they want. But the same principle applies, that we have to love each other, and we have to just bear with each other through everything, because love bears all things.
And lift each other up, encourage each other.
And of course, love each other. Well, thank you both. It's so good to have you already now in the new year, and I hope you're going to be joining us again soon.
Excellent.
And thank you again for such great insight, especially Lesley. You've been giving us that professional view of life and pointing out that even for professionals, it's not always straightforward and easy to do. God bless.
Okay, God bless.
So for all of you watching today, where are you in your relationship? Are you already caring for someone, or are you someone who's needing care? That's part of our loving relationship. You see, that's what Jesus did. He took the sick and he loved them. He took the unwanted and he loved them. He took the smelly and the ones who are just the reprobates of society and he loved them. But when it comes to your spouse, we're in a special place of love. Like God, he always puts us first, and we put our loved ones first. So, in sickness and in health, be love. God bless. If you were blessed by this video, why not give it a like? Also, subscribe to this channel and hit the bell icon to be notified of future videos.